Hello everyone. In this video, we will quickly look at a few important points about the pharyngeal apparatus. Now, the pharyngeal apparatus develops in the front of the neck and is responsible for the development of most of the structures in the head and the neck. So, the pharyngeal apparatus consists of arches in the center, and these arches are covered by pouches on the inside and clefts on the outside. They are located in the lateral wall of the primitive pharynx. So there are two sets which develop on either side of the primitive pharynx, and they eventually grow into the midline to fuse with each other. As you can see, there are two sets and they will eventually grow in the midline and fuse with each other. And they develop in the lateral wall of the primitive pharynx. And initially they are seen as 6 cylindrical bars. But the fifth one disappears, and so eventually what we are left with are the first, second, third, fourth and sixth pharyngeal arches. So as you can see in this diagram as well, the way we number it, it's 1, 2, 3, 4 and 6. The fifth one disappears. Now let us look at where they come from and how they originate. So the pharyngeal arches, these central structures, the central cylindrical structures, they come from mesenchyme, which is derived from the neural crest cells. The clefts, which are located on the outside, are ectodermal in origin, and the pouches, which are located on the inside, are endodermal in origin. So the arches come from the neural crest cells, the clefts are ectodermal and the pouches are endodermal. And these arches, they consist of various structures. So they give rise to various structures, and the structures that they give rise to are a nerve, muscle, cartilage, bone and artery. So every arch is going to have some of these structures: nerve, muscle, cartilage, bone and artery. Now let us look at the structures derived from each of these arches. So as we discussed, each arch has a nerve, artery, a skeletal element which could be either a bone or a cartilage, muscles, pouch and a membrane. So we will look at each arch under these headings. In the first arch, the nerve that is involved is the mandibular nerve. The artery is the maxillary artery. The skeletal or the bony cartilaginous elements are the maxilla, mandible, malleus and incus present in the middle ear, anterior ligament of malleus and the sphenomandibular ligament. So you can see here everything related to the mandible, the mandibular nerve, maxilla and mandible and sphenomandibular ligament, and also things related to the middle ear, the malleus, incus and the anterior ligament of malleus. Now keep in mind, the malleus incus are a part of the first arch, but the stapes is not a part of the first arch. Now if we look at the muscles, the tensor tympani muscle is something that is present in the middle ear, and so this is a muscle that comes from the first arch. Then we have the tensor veli palatini, the muscles of mastication, which we know are related to the maxilla and the mandible. Then the mylohyoid muscle and the anterior belly of digastric. These are the muscles which come from the first arch. Tensor tympani, which has a connection to the middle ear, the tensor veli palatini, muscles of mastication, mylohyoid muscle and anterior belly of digastric. Then if we look at the pouch, which was the endodermal structure, we get the middle ear cavity and the eustachian tube from the first pharyngeal pouch. The middle ear cavity and the eustachian tube, which is quite obvious since we are getting all the middle ear structures from the first arch. So the middle ear cavity and the eustachian tube are also derived from the first arch. In the membrane, we have the first arch membrane, which is the tympanic membrane. So the tympanic membrane is formed from the first arch, and the thing about the tympanic membrane is that it is formed from all three of the layers: the ectoderm, mesoderm and endoderm. All of these three layers of the first arch give rise to the tympanic membrane. So let us quickly revise: the mandibular nerve, maxillary artery, maxilla, mandible, malleus incus, anterior ligament of malleus and the sphenomandibular ligament. Then we have the tensor tympani muscle, tensor veli palatini, all the muscles of mastication, mylohyoid, and anterior belly of digastric. Then in the pouches, we have middle ear cavity and eustachian tube. In the membrane, we have the tympanic membrane. Keep in mind that whatever nerve is involved with a particular arch will be responsible for supplying all the muscles that come from that arch. So in the first arch, all of these muscles are supplied by branches from the mandibular nerve. Now for the second arch, we have the facial nerve, which is the main nerve. The artery is the stapedial artery. The skeletal elements involve the stapes. Now remember, malleus and incus come from the first arch and stapes is from the second arch. The styloid process comes from the second arch, the stylohyoid ligament, and the hyoid bone, the lesser horn of the hyoid bone and upper part of the body of the hyoid bone. Lesser horn and upper part of the body of the hyoid bone come from the second arch. In the muscles, we have the stapedius muscle, the stylohyoid muscle, all of the facial muscles, and the posterior belly of digastric. Remember, the anterior belly came from the first arch and the posterior belly will come from the second arch. And again, muscles of mastication from the first arch and facial muscles from the second arch. Next, in the pouch, we have the epithelium of the palatine tonsil. So we come in the oral cavity now, and the palatine tonsil epithelium comes from the second arch. Now quickly, facial nerve, stapedial artery, stapes, styloid process, stylohyoid ligament, and lesser horn and upper part of the body of hyoid bone. Stapedius muscle, stylohyoid muscle, all the facial muscles and posterior belly of digastric, and the epithelium of the palatine tonsil. The nerve for the third arch is the glossopharyngeal nerve or the ninth cranial nerve. The arteries will be the common carotid artery and the internal carotid artery. The skeletal element, the bone that comes from the third arch, is the hyoid bone, the greater horn and lower part of the body of hyoid bone. Now we discussed the lesser horn and upper part come from the second arch. So the remaining part, the greater horn and the lower part, come from the third arch. And the only muscle that is supplied by the glossopharyngeal nerve, the only single muscle that comes from the third arch, is the stylopharyngeus muscle. Finally, in the pouches, we have the thymus and inferior parathyroid. So the thymus gland and the inferior parathyroid gland come from the third arch. Glossopharyngeal nerve, common carotid and internal carotid arteries, greater horn and lower part of hyoid bone, stylopharyngeus muscle, and thymus and inferior parathyroid gland. In the fourth arch, we have the superior laryngeal nerve, which is a branch of the vagus nerve. In the arteries, on the right side, we have the subclavian artery. So the right subclavian artery and the left arch of aorta. They are the arteries which come from the fourth arch. Then we have the thyroid cartilage and the epiglottis. In muscles, we have all the muscles of the palate and all the muscles of the pharynx, except the stylopharyngeus muscle, which we know is supplied by the glossopharyngeal nerve and it comes under the third arch. So all muscles of the palate, all muscles of the pharynx except the stylopharyngeus, and finally the cricothyroid muscle. And in the pouch, we have the superior parathyroid gland. Finally, in the sixth arch, we have the recurrent laryngeal nerve, which is again a branch from the vagus nerve. The arteries are the pulmonary artery on the right side and ductus arteriosus on the left side. So the pulmonary arteries, which take blood from the right ventricle into the lungs, come from the sixth arch and on the right side. And then on the left side, we have the ductus arteriosus, which is the connection between the pulmonary artery and the aorta. Then in the skeletal elements, we have the cricoid and arytenoid cartilages. In the muscles, we have all the muscles of the larynx except the cricothyroid muscle, which we know comes under the fourth arch. So all the muscles of the larynx except the cricothyroid muscle.